hard to find anyone who is completely happy with their own body.
Plastic surgeons can help take care of problem areas, whether it's breast augmentation, breast reduction, liposuction, body contouring. A lot of questions and a lot of areas that we can explore here.
Yes, so we have with us today Dr. Kayser, a board-certified plastic surgeon. He's out of the Detroit area, but he does service patients across the state and actually even across the region.
And we're so excited to introduce the viewers of 8 West to you and the services that you offer, because you really hit this hard. You have to go for board certification when you are choosing a plastic surgeon. Tell us what that means.
Absolutely. I think there's a lot of confusion with patients who are diligently trying to research the right doctor for them. And just because you're board certified doesn't mean that you're qualified to practice plastic surgery. Plastic surgery is one of the many specialties within the auspices of the American Board of Medical Specialties, which governs those who are properly trained and credentialed to practice within their specialty. Being board certified by the American Board of Plastic Surgery definitely sets the tone for meeting both academic and ethical requirements. There are a lot of cosmetic surgeons who are not properly trained to meet these criteria, and although they may be certified in other specialties, it doesn't necessarily mean that they are board certified by the American Board of Plastic Surgery.
And it is a huge decision to make when you're thinking about any kind of surgery, and people need to approach it with specific questions and find someone like yourself who can provide those answers before they even step into it.
Yes, I think that by the time patients have diligently researched, and that's the fun about this, is that there's no one doctor for everyone. There are a lot of varieties in the way we approach this and in how we feel. And patients will have the opportunities to see your work, to see your credentials, and then when they finally meet with you, get a feel for what your staff is like and how you approach your relationship with them, because that's what this is. This is potentially a lifelong relationship.
Yeah. Right. So what would you recommend as a couple of good questions when a patient is just starting to look for a doctor?
Are you board certified by the American Board of Plastic Surgery?
Number one.
Yeah, that's the key.
That's the one.
Absolutely. What's your experience? Can I see examples of your work? We also have many patients in our practice that are willing to share their experience with them. We welcome patients as often as they want to come to our office to visit with us. What's your perception of the office staff? You can garner a lot of information on how your office staff greets and interacts with patients. Go on your website. My website has a lot of information.
Yeah, I was going to say,
really,
information, seeking out that information. What are the primary reasons why people decide to have plastic surgery? It's not just for cosmetic reasons. There are people who have really important decisions to make about their personal health that involve plastic surgery.
Yes. Yesterday was a perfect example of a very long day in surgery. I had my first patient, which was a cosmetic liposuction patient. My second patient was a breast reconstruction from cancer. So it covered the whole gamut, which is what makes this so exciting. It offers an opportunity to really explore every aspect of the body. And that's another aspect of what makes plastic surgeons unique. We are the only credentialed specialty that is recognized to offer services to the entire body with regard to plastic and cosmetic surgery.
Okay, and now you service all age groups, correct? It's not just based in one area, and also both men and women.
Yeah, I actually, after completing my plastic surgical residency, did a craniofacial fellowship. So that also involved a pediatric specialty. I love children as well. So cleft lip and palate children, for example. My practice has, at this time, however, as I believe, because that really involves a multidisciplinary, more university setting, have really migrated towards breast reconstruction and the cosmetic aspect.
You know, and I have to ask you, I have 3 kids. My youngest I nursed for 2.5 years. I'm in my mid-40s. Probably women in my age range are thinking about, their body isn't what they'd like it to be, and no matter how much exercise you do, you're not going to change certain things. What are you doing in terms of reconstruction, breast lifts, those sorts of things?
Big question.
Yeah.
You wanted to answer that in 30 seconds
Yeah.
or 3 hours?
Yeah. A lot to explore.
There is a lot to explore, and every patient has unique needs and concerns. And it's always interesting to meet a patient for the first time, because what my eyes see doesn't necessarily reflect what a patient's needs or desires are.
Right.
So it's important for me to just sit back and listen and ask, what are your concerns? Because this isn't about me, this is about you. Once we get into that rapport, I start to see through your eyes. And as I start to learn more about you, then I can also begin to allow you to see through my eyes. And in that respect, we kind of develop this relationship so that ultimately you are able to achieve the result that you want.
So that's really about getting on the same level.
Absolutely. And I think once you accomplish that, you really, really have, I think, passed one of the biggest obstacles. Patients, not uncommonly, will come back to a physician, or I'll see patients for revisional surgery where their biggest concern was, you know what, he never listened to me. Mm-hmm. And all of a sudden they end up with something that they really didn't want. And I think if we can really connect in that way, half the battles over.
Well, Dr. Kayser, we're going to be visiting with you at times over the next several months as well, and very exciting and very interested to hear about what you have to say. So thank you for joining us today.
Thank you for having me.
And of course, as we continue with 8 West, we're going to talk about changing topics here. Many lakes and rivers to enjoy around here during the summertime.
We're thinking about the summer, but not this time of year do we think too much about swimming.
And that's why the East Hills Mac Orchard Hills family of clubs is a great place to take your family. Classes for all ages. We'll take a dip coming up next.
That's West.